Hi, I'm Dr. Kella, and I'm going to talk to you about a vasectomy. A vasectomy is a simple procedure that we do in the office to offer permanent birth control to men. It usually takes us around 10 minutes to do. I used local anesthetic. We could even use laughing gas or in-office anesthesia. There's many ways to make this vasectomy as painless as possible for you. It's done without a knife. There's no stitches afterwards, and usually I can do the procedure through one small opening at the top of the scrotum. It's called a no scalpel technique, and we use what's called an open-ended technique. So during the procedure, I divide the tube, and then that tube, which is called the vas, I seal one end with a hot needle to kind of seal it shut, and then I leave the testicular side open. That way there's less chance of any congestion or epididymitis, which is swelling of the tubes after the procedure. The procedure then can be done where you will be able to go home right afterwards. You'll be able to walk out of the office, and there's going to be usually minimal pain. We tell patients to think of the word RICE. R is rest, I is ice, C is compress, E is elevate, which you don't have to worry about elevation here. But resting, especially the first 24 hours, is very helpful for your vasectomy. I tell patients, look, you can get back to full activity in about a week, going to the gym in a week, going in a swimming pool, hot tub, back to sexual activity, wrestling with the kids, all that in about a week. Can you walk? Sure, but for the first few hours, you should probably go home and just relax. The procedure should not require any pain medications, but you can take some Tylenol or Advil if you would like. The benefits of the vasectomy, well, it's permanent birth control, it's outpatient. The procedure has very low chance of any sort of bleeding or infection. The procedure does have a failure rate. It's less than 3 out of 2,000. We don't know why it can happen, why the tubes reconnect, but they could. The procedure, you're not clear until we get you tested. So after 20 to 30 ejaculations, usually after 2 to 3 months, we want to make sure that you get tested. Most of the patients will use a kit that you can do from home and get the results back to make sure you're good to go. The procedure has a small chance of bleeding or infection. You may have a little bit of bruising, but usually it should not be that bad at all. The procedure could be reversed, but we don't want you to have that mentality. Usually within the first 6 to 8 years, it can be reversed. People have asked if this is associated with prostate cancer or any other problems, or is this going to affect my urination? Is this going to be able to affect my sexual function? Is it going to affect the way my ejaculate looks? It should not affect any of those things. That's what is one of the real big advantages of a vasectomy. So again, we really want to make sure this procedure is as painless as possible for you. So I use local anesthetic. We have some nice music playing in the room while we do the procedure. If you want, we have laughing gas. It's available. It's safe. You can drive yourself home right afterwards. It's not going to put you to sleep, but it will help relax you. We also have anesthesia where a CRNA will come in and he or she will actually use an IV with propofol and just make you sleep where you don't remember anything about the procedure, making it completely painless. With that, you do need to make sure that you have a driver to take you home, and we'll tell you not to have anything to eat or drink prior to the procedure. So vasectomy, no scalpel technique at the urology place. I'm glad you came here for the consultation, and I'll be happy to answer any other questions you may have.